The Nelson Mandela Children's Hospital Trust told donors that the government would cover running costs. Hospital CEO Mandisa Mahalwana said the government endorsed and committed to supporting the hospital as early as 2009, but asked why all costs had not been covered. The Treasury told The Times this hospital was built by a non-profit organization prior to formal financial commitments by the government. The Treasury has allocated R150 million to the hospital for this financial year, and has earmarked R200 million for 20,182,019 and R300 million for 20,192,020. An agreement between the Trust and the government was signed last year, said Mahalwana. The Treasury has not promised funding after the 20,192,020 financial year, but would re-evaluate as the commissioning takes place and in line with performance. The hospital was to have opened in December, but the Treasury did not allocate money beforehand, so employees could not be hired. Running costs of R500 million a year were calculated by consultants in 2010. Mahalwana said that estimate could rise, given the rand's weakness and the increasing cost of imported drugs and equipment. He said the hospital trust was still raising funds. The objective is to use government funding to cover the baseline cost and top up all the operational needs through fundraising. The hospital opened in June. About 100 day patients have had CAT scans, which spared them from long waits at Chris Hani Baragwanath Hospital or Charlotte Maxey Hospital. Doctors ask if the R150 million has been properly spent because top specialists are paid well to attend to just a few day patients. 2 anaesthetists and a cardiologist are paid by the government. The pediatric ICU and pediatric nephrology head started work in September. The Times visited the hospital last month. 2 children underwent MRI scans in the entire day. That should have taken about 3 hours work for one anaesthetist. The Treasury said conditional grant funding for the hospital could legally amount to only 65% at most of its costs. The hospital would have to raise the balance. Mahalwana said safety concerns over patients had delayed the opening. But the Treasury put the delays down to a shortage of funds, saying operations would be ramped up as capacity and resources became available. Staffing is another problem. There is a countrywide shortage of specialist pediatric surgeons, cardiologists, pediatric anaesthetists and pediatric nurses. Recruiting these highly specialized staff is daunting. There are never enough specialist doctors and specialist nurses, said Mahalwana. Do we need it? Asked a state doctor. Yes, but considering they get our $150 million a year and are seeing maybe 30 outpatients a week, we could do a lot more with that money if it went to clinics seeing hundreds of patients a week. Health Department spokesman Joe Mailer said the hospital was needed. We need more. In other countries they have many more children's hospitals than the whole African continent, he said.